of sponsors who've come in for monoclonal antibody studies. We are already well into that treatment, synthetic antibodies that will provide, that the theory is will provide protection against the infection of the virus. And we're hopeful that those studies by the late summer, early fall will provide us information about their effectiveness and safety.
So you're optimistic that there will be more than one treatment available this fall for teachers, administrators, older adults?
Yes, sir, I'm optimistic.
Thank you very much, Senator Murray.
Thank you very much to all of our witnesses. We all very much appreciate your service and your work. Dr. Fauci, last time you testified before this committee, you warned us of needless suffering and death if states begin reopening too early, and just over a record number of cases. We do not have enough tests and we do not have enough contact tracers. And just yesterday, CDC's Dr. Schuchat said we have too much virus to control in the US, arguing, and I quote, "This is really the beginning." Our strategy hasn't worked. I wanted to ask you, what do the federal government and the more than 30 states with rising case numbers need to do to reverse this trend?
Thank you very much for that question, Senator Murray. I am also quite concerned about what we are seeing evolve right now in several of the states. As you know, in 4 of the states, in Florida, Texas, California, and Arizona, more than 50% of the new infections are in those areas where we're seeing surges. The things we need to do, I think you alluded to in your question to me, we've got to make sure that when states start to try and open again, they need to follow the guidelines that have been very carefully laid out with regard to checkpoints. What we've seen in several states are different iterations of that. Perhaps maybe in some going too quickly and skipping over some of the checkpoints. But even in states in which the leadership in the form of the governors and the mayors did it right with the right recommendations, what we saw visually in clips and in photographs of individuals in the community doing an all or none phenomenon, which is dangerous. And by all or none, I mean either be locked down or open up in a way where you see people at bars not wearing masks, not avoiding crowds, not paying attention to physical distancing. I think we need to emphasize the responsibility that we have both as individuals and as part of a societal effort to end the epidemic, that we all have to play a part in that. And I think if you look at the visuals, what we saw were a lot of people who maybe felt that because they think they are invulnerable, and we know many young people are not because they're getting serious disease, that therefore they're getting infected has nothing at all to do with anyone else, when in fact it does. Because if a person gets infected, they may not be symptomatic, but they could pass it to someone else, who passes it to someone else, who then makes someone's grandmother, grandfather, sick uncle, or a leukemic child on chemotherapy get sick and die. We've got to get that message out that we are all in this together. And if we are going to contain this, we've got to contain it together.
Well, I assume that would mean that elected and community leaders need to model good public health behavior and wear a mask.
We recommend masks for everyone on the outside. Anyone who comes into contact in a crowded area, you should avoid crowds where possible. And when you're outside and not have the capability of maintaining distance, you should wear a mask at all times. Thank you.
Dr. Redfield, last week, Dr. Julie Gerberding, who served as the CDC director under President George W. Bush, testified to our committee that if she were in charge, one of her top priorities would be the creation of a national vaccine plan that addresses the science, development, allocation, uptake, and monitoring of a vaccine, saying, quote, "We know this is in our future and we are not ready for it." I couldn't agree more. And that plan has to detail how the federal government will scale up manufacturing, coordinate the supply chain so we avoid the missteps we saw with testing. It needs to combat misinformation and vaccine hesitancy and make sure that vaccine distribution addresses health disparities and a lot more. Dr. Redfield, do you agree a plan like that is needed?
Senator, I think it's very important that we have a integrated plan for this vaccine.
When can we expect to see one?
Well, I'm going to ask Dr. Hahn if he'd like to comment. I know recently they had a vaccine perspective. CDC is working on the issues that you said that I think are so important in building vaccine
Can
confidence
you
in
tell me
this
when
country.
CDC will be giving us their plan, since CDC would be writing the comprehensive plan?
We're developing a plan as we speak, and again, to keep building on the efforts that we have to rebuild what I call vaccine confidence in this country, which is really critical. And then on top of that, there'll be a very defined plan for distribution of this vaccine, prioritization of this vaccine,
But you
monitoring
can't tell
for
us
safety
it'll
of
be
this vaccine.
a couple weeks, a couple months, the end of the year. Do you have any estimate on when we'll see that plan?
Well, it's currently in development within the group, and I'd anticipate that we'll see that plan in the near weeks ahead, Senator.
Weeks, not days, months?
In the weeks
You're-
ahead, it's a collective effort that we're doing together within the concept of Operation Warp Speed. But CDC's been working on this plan literally for probably the last 10 to 12 weeks.
Well, Mr. Chairman, I would just say we need to see that plan. We need to know what it is. The American public needs to know what that is. Communities need to know what that is. So I hope that we urge that plan to be public spec.
Thank you, Senator.
Senator Murray. Senator Burr.
Thank you, Mr. Chairman. Working on pandemic policy now for 17 years, I'm reminded this morning, Tony Fauci's been doing it twice as long as I have, and most of you at the dais have been doing that as well. I urge my colleagues, pay attention to what each of these individuals say, because some things are predictable up here. Congress is a full-fledged partner and funds things when there's an urgent need, a threat that's, I know, Tony, you've seen over the years, when there's not that threat out there, things get shelved, like platforms that we could have developed and have better countermeasures today. And